Well, Minnesota health officials say the COVID-19 variants are becoming more prevalent and they're concerned about the risk of another possible spike in cases despite the progress on the vaccination front. KTTC's Sarah Gannon is live in our studio with an update on what's happening. Sarah?
Well, Tom, Minnesota public health experts are keeping a close eye on several COVID-19 variants right here in the state.
As of Tuesday, 2 cases of the P1 variant from Brazil, 6 cases of the B1351 variant from South Africa, and 108 cases between the B1427 and B1429 variants from California have been confirmed in Minnesota.
Most mutations don't have much impact, but some can make a virus more transmissible and or more likely to cause severe illness.
Health officials are concerned about the California variants because they have the potential to spread more easily and may be less responsive to prior immunity or vaccine-based immunity. In addition, there have been 479 cases of the B117 variant from the UK.
Experts have predicted that B117 will be the predominant circulating strain in the U.S. due to its higher transmissibility.
State epidemiologist Ruth Linfield says it's a race to vaccinate more people versus the growth of variant cases.
A more infectious virus spreading widely among millions of susceptible Minnesotans, some who may be tempted to relax their social distancing, masking, and other precautions, can help fuel a third spike in COVID cases and a corresponding increase in hospitalizations and deaths.
Another issue, breakthrough cases, which is a situation when someone who has been fully vaccinated still contracts the virus.
In a small number of vaccinated people, their immune response isn't strong enough to the vaccine to completely prevent infection with the virus if they were to come across it.
Erzman says the vaccine is 95% effective, which means we could see infections in 5 of every 100 people fully vaccinated.
It's important to know that even if someone is vaccinated and then goes on to be one of the few unfortunate people to develop a breakthrough case, there can still be some level of protection provided by the vaccine.
Erzman also says of the more than 800,000 Minnesotans who have been fully vaccinated, 89 breakthrough cases were detected, which is less than 0.1%. Also of note, there have been no deaths in any of these breakthrough cases. Tom and Caitlin?
Sarah, thank you. And some good news